because our role is so varied, and we are doing so much, so we're doing assessments, we're doing relationship building, we are helping manage symptoms and side effects of treatment, and I could go on and on and on. The key thing for the lung cancer nurse specialist at the minute is resources, so we're under-resourced. An example of that would be when you've seen a patient in clinic and they've been told that they have a diagnosis of lung cancer, and then the clinic ends and you leave the room with the patient and you need to speak to them separately for maybe 10 minutes, maybe an hour, depending on the patient need, and there's no rooms. So I physically have nowhere to take a patient to have that private conversation, and that's lack of resource and lack of planning on a management level to for them to acknowledge that we need that in place. And I think that's one of the biggest challenges at the minute, and that is what we need essentially to be able to continue to do the role that the patient expects from us, but also the role that we want to provide and the service that we want to provide. I think moving forward, the role of the lung cancer nurse specialist is becoming more and more specialised, but in more than one area. So things like smoking cessation, we need training on that. Being able to do nurse prescribing so that we can prescribe smoking cessation aids, but also being able to prescribe things like morphine, steroids, things to help manage side effects of treatment, but also symptoms of lung cancer itself. So all this additional training, I think, is really important for us to be able to access.